I rise in completely full support of this bill. I am Vice Chair of Public Health, Vice Co-Chair of Public Health. Representative John Michael Parker is the Vice Chair in the House. And I have sat through too many screenings, Senator Anwar and Senator Summers, but they truly work together. And, you know, my constituents often ask me, what is it like up in Hartford? Is it like what happens in DC? And I say, no, it isn't anything like that at all. I said, we work together. We don't always agree, but we figure out compromise. And I am very privileged as a freshman to be Vice Chair of Public Health and to see Senator Summers and Senator Anwar and how you do work together so well to get this unbelievable bill passed. I could say one of any parts of these bills is really going to change people's lives, from just the people diagnosed with mental health getting that Haldol, nurses call Haldol vitamin H because it makes them happy, and it just makes the patient a little easier to deal with when you're in a hospital setting. They're not going to need it at home, but because that was given, they're not going to get to be treated at a nursing home. So I'm not going to go through every part of this bill. Everybody has done that beautifully, but this bill truly, truly, truly is going to make our constituents' lives so much better. Like every single part of this bill. And I do have to thank Senator Duff and Senator Looney for making this bill Senate Bill 1, which to us in our caucus, we think that means the most important bill, at least I think it does. And when Joyce Grayson was murdered, I immediately texted Senator Anwar and leadership, and I'm not a press conference person, but I said, we have to have a press conference about this. And Lieutenant Governor Susan Bysowitz was there in support of us, because we have to make sure we keep this on everybody's radar. It can't happen to her and then nothing happen afterwards. Because I am telling you, every single home care worker will tell you that there is so much violence and abuse when you go into people's homes. And can you imagine in 2024, there is nowhere to report it. We do not report anything that happens to us when we go into a patient's home. So I am thrilled with what we've done with this. I'm thrilled that we have a working group so we can continue to assess it and make it better, and that in part of that work group has actual direct care workers, because we all know sometimes when you get into management, you start thinking about the numbers and you stop thinking about what happens to the people in the field, and you think about productivity, which that's all important, but we need direct care workers there to make sure we're safe. So OSHA, which we do not have OSHA regulations when it comes to any kind of health care. I have been to DC many times advocating for that. Representative Courtney has a bill that he's been trying to get into the Senate, and he's been unable to get it there. But there are really no OSHA regulations right now. And actually the agency that Joyce Grayson was working for didn't even report the death to OSHA, because it's just something you don't do. And when Otto Morulane died, he was a private care attendant in Niantic, Connecticut. When he died in a fire, I talked to OSHA 3 days after the incident, and they didn't even know that had happened. So there could be other home care workers that have died in fires, have been really injured, that we don't know about. So we still have a lot of work when it comes to reporting, but this is a great place to start. And I just want to read that OSHA did finally come out and they fined the company, and they made a statement, and it just says, the company could have reduced the hazards of workplace violence by, among other ways, performing root cause analysis of incidents of violence and near misses, providing clinicians with comprehensive background information on patients prior to home visits, providing emergency panic alert buttons to clinicians, and developing procedures for the use of safety escorts for visits to patients with high-risk behavior. That is what OSHA fines the company for, and that is exactly what we have in our bill, Senator Anwar. And I am just so proud to work with you and to have that part of our bill. And we're gonna make the lives of many home care workers, it's a hard job. You're not going into easy houses every time you go take care of a client. That we are going to make the stress on our home care workers much better with this bill, and the stress with every part of this bill better, because it does so many good things. So, Madam President, thank you for the indulgence, and I really encourage everybody to support this very bipartisan bill that we should all be so proud that we all work together to get it passed. Thank you very much, Madam President.